A local nonprofit's mission is to promote and support healthy pregnancies, babies, and families by providing a maternal and child health system of care through community partnerships. They have a program coming up that you're going to want to check out, and the details are coming up next. Welcome to Polk Place. I'm your host, Tina Mann, and joining me in the studio today are Dr. Lynn Marshall, the Senior Pastor with Spirit Life Ministries, Dr. Joyce Aaron, the Associate Vice President of Women and Children's Services with Lakeland Regional Health, and Tanya Akwete, Community Liaison with Healthy Start Coalition. Welcome.
Welcome. Thank you for having us.
So why don't we start out a little bit about talking about the event that you guys are promoting. From your shirt, it is Melanin Families Matter. What does that mean?
Melanin Families Matter is an event that is open to the Polk County community, and it's a free event. And our whole purpose is a group of ladies come together from different organizations to bring awareness, provide resource and education about an immense problem that's actually transpiring in Polk County that also affects the state of Florida and nationally. And that is that our African American babies are 3.5 times more likely to die before reaching their first birthday compared to Caucasian babies, as well as babies from other races. And so what we want to do is be able to come together, bring awareness, provide information so we can reduce the infant mortality rate.
I was kind of doing a little bit of research prior to coming on about that, and I was just kind of fascinated by it and kind of horrified because I had no idea. So have you guys identified any reasons why you guys' rate is so high?
Based on research, there's multi-layers that involve why our infant mortality rate here in Polk County and across the state of Florida is higher than other counties in our state. Dr. Michael Liu, who is a national researcher, has shown that African-born immigrants to our country, their preterm low birth rates, all of that is equivalent to Caucasian women born in our country. However, they dove in deeper and used that African American woman born in the United States and compared it to a Caucasian woman, and the rates changed drastically. So everything was equal: where they lived, where they worked, what they ate, access to the care. And our African American born in the United States babies were still born too early, which is preterm, less than 37 weeks, and born too small, which is we would like 5 pounds, 8 ounces.
Wow. I mean, that's a striking statistic. What were you telling me about the percentages prior to going on?
It's the goal for the whole nation is 6 deaths per 1,000, which still sounds terrible. They are expecting 6 babies out of every 1,000 to die. But here in Polk County, the African American rate is 16.6%. Yeah. So it's way, way too high. And we know that infant mortality is really the barometric tester of how healthy a community overall is. So if we have infants dying, it's showing that the health of our community at large has a lot of room for improvement.
And so let's go a little bit more into the conference. What is going to happen at it? I mean, what all are you going to have?
So we're really excited because we are going to have a full medical birthing panel. That's going to be comprised of OBs, pediatricians, doulas, as well as just mommies. And so they'll be there to answer any questions that our audience may have. There are some times where people don't know what to ask or they're not sure should they ask. And so they'll have a segment for that. We'll also have a fatherhood panel. And that's really important too, because a lot of times people don't necessarily understand how crucial the presence of a father in a family's life is important. So we'll have some males there representing those that co-parent, as well as there's some fathers that have had to raise children on their own. We'll also have raffles. We'll also conduct some further research because we want to be able to find out exactly what exactly is affecting our community. What, based upon those 7 social determinants of health, is it housing? Is it poverty? Is it transportation? Is it racism? And we really want to be able to focus and see what is it so we can go ahead and bring further resources to our community. And in addition to that, we'll also have some pampering. So our Ridge Technical College students will be there, and they'll be providing free massages. We'll have estheticians there. We'll have cosmetology students. And so they're going to have a lot of fun. There's going to be a lot of resources, a lot of education, and it's just going to be really great.
That sounds awesome. So who is your target audience? Who do you want to come attend to this?
Our target audience is open to everyone, but we are targeting Melanin families. So that would be African American families. And it doesn't matter their education level, their social background. We want them to know that this can affect everyone, regardless of where they come from, their financial background. We want them to know that, hey, our African American ladies as well as babies are at risk, and we want to minimize those risks as much as possible.
That makes sense. So how are you guys promoting this event? Where can people find more information?
So they can find information on the Florida Department of Health Twitter website, as well as the Florida Department of Health, their website. Healthy Start Coalition, there's also information on that website where they can go and register. In addition to that, it's also on the Facebook. Is that correct, Tanya?
There's a Facebook event. You go in and type in Melanin Families Matter, and you'll see a link pop up with the same logo that we're wearing and sharing the information for the event.
Excellent. Is this the first event you guys have ever held like this?
It is,
Yes.
so we're really excited, yes.
That is.
Our maiden voyage.
And it's going to be held at the new pavilion, which is absolutely gorgeous and so welcoming. So, I mean, that gives them a chance to check that out as well.
Absolutely.
So that's going to be March 9th, and it's in the morning, right?
That's correct, at 9 a.m.
9 a.m. to 1 p.m. And you said everything is completely free.
Absolutely.
Absolutely.
Okay. Well, I'm curious, and let's talk a little bit more about what you guys are doing beyond this to reduce these rates here in Polk County and what's being done on a state level.
So Ty and I both work for Healthy Start Coalition, and one of the things that we are doing, we encourage safe sleep. And so that basically is how a baby should be put down properly on their back without any pillows or any blankets. So that's one thing that can help reduce the infant mortality rate. In addition to that, we want them to have equal access to care. So making sure that the women, when they go in and they see their doctors, that they can be an advocate for themselves. So giving them information and teaching them on how they can have a voice in the community, as well as when they see their provider.
We have the Safe Sleep, as Dr. Marshall mentioned, but we also have a case review team through the Healthy Start Coalition, and there we review different cases throughout the county to find out why our babies are passing away. And so we've seen that safe sleep has been one, prematurity, but with prematurity we know there's things that we can't address, but we want to educate the community. So we're working on making sure all of our birthing centers and our hospitals have the same messaging really for safe sleep, because unfortunately in Polk County we had 13 babies didn't make it to their first birthday due to unsafe sleep.
And I know you had mentioned something about the ABCs.
ABCs, so those are the basic things to remember for anyone. So the babies need to be alone, on their back, and in their own crib. No bumper pads, no stuffed animals, none of those fun things. Ideally, they'd be sleeping in a sleep sack so that there's not additional blankets or pillows, because those are things that can all cause a death of an infant. So we don't only teach parents in the hospital, but we're also trying to teach grandparents and caregivers. So we're on our committee, we're thinking about different ways in which we can approach the community, and so we've got lots of ideas, and the committee's fairly new, actually. I think that Tanya was really at the beginning of it. I joined when I moved here in last March, but it's been going on since last January, I believe.
Yes.
So it's really a new committee, so this is our first big event, but I'm sure that we're going to be offering more, and we just really want to make the point to, you know, it takes a village. It
Right.
really
It really
does.
does.
Absolutely.
And it's not only the parents that we're trying to teach, but those caregivers, babysitters, daycare centers,
Right.
and grandparents and aunties and all those folks, because we all raised our children, people of my age, I'm older than these ladies, but we all raised our children a certain way, but you know, research has shown that there are changes and it's not the same as it used to be.
Right.
So we need to be up to date on what the right practices are, because those mothers and grandmothers and aunties have so much influence on new mothers today. So we all need, I'm challenging the ladies of my age to be up to date with what the research tells us for safe sleep.
And that's what you do. You don't talk to your doctor. You say, Mom, how do I
That's right.
handle
Right,
this issue?
right.
I mean, I have 3 kids and they're pretty much all teenagers at this point, and I still am like, Mom, how did you survive this?
right,
Much less,
right.
what do I do here? But I know that, there's so much conflicting information, especially with social media, about, issues with raising your kids and things like that, and people are so quick to get offended by things, even if you're just trying to step in and help. So I like the informational model where you're trying to get it out so that maybe it'll come to them not as, I'm personally attacking you because you're not putting your child in your car seat, right?
Right.
I mean, or, oh, I'm just sharing this information. So that
Right.
also gives people a resource to just, spread that word. So that's a
Absolutely.
really good thing you guys are doing. Because we got to save the babies.
Absolutely.
Yes, that's the
'Cause,
reason we're here.
I mean, my 3 are adopted, so I never got to have the baby, so I'm always up for cuddling the baby, so. But it's a good thing, and you guys are doing some amazing stuff, and I look forward to hearing about your events in the future.
Thank you. Thank you for having
much.
us.
Yes.
Make sure you check out Melanin Families Matter Saturday, March 9th from 9 a.m. to 1 p.m. at the Lakeland Regional Health Carol Jenkins Barnett Pavilion for Women and Children, 1324 Lakeland Hills Boulevard, Lakeland. You can help save future lives and close the gap and promote access to fair and equal health treatment for Black mothers and babies in Polk County. Call 863-223-6258 or 863-578-2141 to register. For more information, you can look them up on the web at www.healthystarthhp.org.